Hello, my name is Andrew Regalato, and this is my presentation on schizophrenia. Schizophrenia is a disease that affects many. The disease has a relatively broad base of symptoms. However, the lion's share of what would be part of the etiology of schizophrenia is visible through monitoring the behaviors of the affected individual. A few of the neurological markers, however, are a mutation of the GL01 gene, measurable reduction in the enzyme activities, and lower than non-schizophrenic patient level of defense against methylglycol, which is a byproduct in the metabolic activities in the neurons, and higher levels of dopamine activity. The primary neurotransmitters involved in schizophrenia is dopamine, glutamine, and serotonin. Schizophrenia is characterized by these two neurotransmitters behaving in a way that is dissimilar to what's commonly seen in the prefrontal cortex of non-affected individuals. The dopamine transmitter is specifically, it seems to be heavily involved with the D2 receptor site. And the D2 receptors that are affected are largely centered in the ventral hippocampus. The primary medications for schizophrenia, now it should be noted that the primary medication for it is antipsychotic medication, and a lot of these other ones are just to help balance the side effects caused by it. But there are two main categories, if you will, for describing schizophrenia medications. Antipsychotics, which we just talked about, and like I said, it's basically you take the medicine and then the rest balance the side effects. And mood stabilizers and antidepressant medications, those are classes of meds you'll see typically with schizophrenia medication, but they are not capable of managing the disorder alone. They need something else with them because they don't have quite enough potency, if you will. Antipsychotic medications typically work on the brain's dopamine receptors by blocking the receptors that are being affected by the disorder. Mood stabilizers, however, typically work in a manner that balances the patient's moods and temperaments to keep them from having a hyper-exotic mood swings. And once again, though, it's still not effective in managing the disorder completely by itself. But it works by blocking the ion channels in the brain and the arachidonic acid turnover. Antidepressant medicine, same thing as the mood stabilizers, not effective in balancing it by itself, but they serve a primary function in that they help treat the depressive disorders and moods that will come from taking antipsychotic medications, and it'll assist with patients that are displaying suicidal thoughts and tendencies to help kind of balance them out. It's not, once again though, by itself, it's not a management philosophy for schizophrenia. The negative side effects of the drugs is suicidal thoughts and actions, insane mood swings, depression, and some of the adverse neurological behaviors. And some of the medicines increase the probability of developing comorbidity by developing an entirely separate disorder. But this will typically, if you take all these and you balance it well, you should be better. Side effects. Okay, now what happens if someone tries to manage it without medication is people who have schizophrenia, they, not all of the time, but they will have a higher probability of attempting to commit suicide when compared to both individuals with schizophrenia that's being managed and individuals without schizophrenia. Their rates are higher than both of them. These individuals will also typically have developed depression, and they may regularly engage in antisocial behavior that doesn't benefit them or anybody else. And they may also have mood swings. Now, that being said, the antipsychotic medication may induce some of these behaviors in them, which is why you take other medications to manage the side effects from it. Otherwise, it just kind of goes from there. The risk and the benefits of the medication. The quality of life is significantly diminished for individuals who are affected with schizophrenia and are not taking the medication. But individuals that take the medication, they must maintain a very strict drug regimen, or they may begin experiencing some adverse effects similar to what occurs if you're not being medicated. And here are the references for the various facts I pulled throughout the thing. If you have any questions, please comment. Thank you.